Now, where meaning come from? Okay, the first guy got me interested is the Franco. I mean, meaning therapy basically means logotherapy, right? Logo means meaning. And the next person influencing me is this Adler's individual psychology. You might know about that, but Franco used to learn from Adler. Remember? Franco used to learn from Adler. So we're influenced by Adler. Adler wrote a book about meaning of life, okay, about the different domains of life, where meaning plays a key role. But the main thing about Adler is his emphasis on social interests. That we're relational beings who have to feel belonging to a group. If you don't feel belong to a group, then you are having a problem. You are going to have a problem. Because everyone wants to belong somewhere. Okay. And the third sort of influence of Roland May and Irvin Yalom, the American brand of existential psychology, we tend to focus on existential anxieties. Okay. And then called behavioral therapy is very powerful because they had to do with how you interpret the world, how you interpret event happening to you. Because meaning simply means what happened to you is less important than how you interpret the event, right? So they try to reframe your cognition, try to change your irrational thinking to more rational, more productive way of thinking. So they kind of, and narrative therapy are very important because all life is story. Life is story, and often we derive meaning about life not from isolated events, but from weaving all those facts together and make a story about your life. The mirror talk about her life story in career. Okay? So that is actually she make it up based on a number of life experiences, her work experience, family experience, and with the government. There's a lot of things. Make it up, make a story. So we keep on. Part of therapy is how to rewrite your life story, so that you can see yourself as a more proactive, more competent agent rather than a victim. Okay. And then finally, it is part of psychotherapy. Now, I have more to say on Saturday, so I'll just leave it there for the time being. And then finally, meaning-centered constant therapy. So that together is the development. So any question about that? So by the way, anybody request, I can send you the whole PowerPoint. Okay, don't need to worry about it. So just leave your email address to my wife. Where's her? Oh, there. So she's my wife. Okay, and she's also my boss. Okay, next slide. Meaning all we need, relationship all we have. These are the very foundations for healing and recovery and wholeness. Now, these two statements are very simple, but there's a lot into it. Okay. Anybody want to challenge the first statement? Meaning is all we need. Yeah. Good. Okay. Thank you. But else want to challenge me? I'll answer your question later on. Okay. Anybody else want to challenge me? Come on, don't have to be so nice to me. I can take it. I know I have gone through a lot. Cancer and this and that. I've gone through a lot, so I can take some criticism. I got thick skin now. And how about the second part? Anybody want to take a shot at that? Do you agree with that?
Actually, I would probably put number 2, number 1.
It doesn't matter. Be my guess. Be my guess. Yeah. Yeah, you might be right. Yeah. You might be right.
I would not challenge you on number 2 at all.
Huh?
I would not challenge you on number 2 at all.
No. Thank you. What's your name?
Dennis.
Huh?
Dennis.
Dennis. Okay. Thank you. Yeah.
I will offer a challenge.
Okay. Be my guess.
It's a challenge that came, I just happened to be reading some papers pressure that she feels to be in relationship when that's not an orientation that comes naturally for her. So for the whole idea of relationship, for people who are more solitary, more introverted, have a greater struggle with that than people who are more extroverted and are more relationship oriented.
Yeah. Okay. I'll grant you that fact. But does this person, can he survive? Can he go through life without any relationship? It doesn't mean how introverted you are. I don't care how introverted you are. Secretly, deep down, they feel lonely.
Right, and so what I was reading, what this particular student was saying is that because we live in a world, this was their interpretation of what they were presenting, where relationships are so important, I feel like there's something wrong with me. Because
Okay,
that's not how I orient myself.
Okay. So that whole thing is, see, any good thing can become bad thing. You put too much pressure. Okay, we say happiness is good. Then say, oh, everybody should be happy. Then you put pressure on the guy. All right. Then happiness becomes bad thing. So relational. Now I don't know that person. You ever say, oh, how are you now? 30. How are you not married? Your parent need a grandchild. Come on, get married. Religion is good, but when becomes pressure, it becomes bad. I'm talking about get involved in a group, get in touch with humanity, not live your life alone in a little corner. I'm not necessarily talking about romantic relationship or marital relationship. I mean, honestly, I don't see anybody can go through life without a need for human touch. Okay, even in no human, they have a dog. Okay, there's still a relationship. Look at a pet. Okay, yes.
So going back to Dennis's point then, for me, I agree with Dennis that relationship comes before meaning. Simply because I think it's the meaning that we attribute to the relationship that we have with the world, whatever those relationships may be, even to innate objects. It is the meaning that we attach to it. And sometimes people don't have words to articulate meaning.
So be my guest. Switch to. Yes.
I just want to bring up, I'm staying with my mother right now, who's 87 years old, and feels like she can no longer contribute to the world in any way. And so I've been around her thinking, well, what does meaning mean when you are past, many times people talk about meaning as being able to contribute to the greater good. So if you get to past the point of contributing to the greater good, what does meaning mean then?
Does mean does she want to stay alive?
No.
She doesn't want to. So life has no meaning to her.
She's at a point where she feels like it should be over.
Yeah, well, sure. It happened. Yeah. Right. At some point in life, you feel that your time's up. Yeah, sure. Yeah. Okay, shall we move on? Yes.
I want to piggyback on what you just said. When I work with the elderly people, at some point when they get upset, they say something like that. What am I living for? Or something like that.
Thank you.
And in my early days, I didn't know how to respond to that. But as I work with them, I said, you give me not just a job, but you bring out the usefulness of me. And I saw a change in their face because they exist not for themselves, but also for other people.
Yes.
Yeah. So it might not make sense.
That makes sense.
It really, I exist, I'm able to benefit her because of her. If she's not there, I won't be there. So it's kind of.
Okay. So we're going to discuss more. Right now, just beginning. We're going to deal with this topic more. Yes.
I'd like to come back as a profound introvert myself who is learning to pretend to be extroverted. Or at least it appears to others that I am. Relationship, though, there is an inner relationship. Frankl defined God for the atheist as the object of our most intimate communication. A relationship is about communication. So there is another relationship, and we assume that these are superficial. But even those outer relationships have an inner relationship. And so we have to remember there's a lot more than what we see on the surface. So if I can respond to your comment in that way, Susan Hotting, what do you
Well, no, and I think that was understood, but there was still a sense that I have to be someone because the world I live in says that relationships with other people are more important than my relationship with myself or with the divine, and so that was the dilemma, I think, in essence. Yeah.
Thank you. Okay, we have 31 slides, okay? We'll be staying. Well, I have to pace myself a little bit, okay? Because I usually offer 2-day workshops on therapy, okay? This is just 3 hours. So I have to pace myself a little bit.
We only had one slide to present.
Okay, that's a random. Okay, next one.